Very perturbed about interrupting Catherine mid-flight, so it's very nice to be here. I too would like to acknowledge traditional owners of the land where we are today, the Eora Nation, and pay my respects to elders past and present, and to acknowledge First Nations people here at this gathering today. And again, like Catherine, to thank Michael. I too always enjoy your welcome to country. And I had one little bragging right, that I was working for the Minister for Aboriginal Affairs, and we heritage listed the Borona fish traps back in the mid-90s, and it was a great thing to be a part of and to learn and understand at that time. So thank you for the education session as well. To acknowledge Catherine, of course, and Tim, thank you for your welcome, for lived experience, and lovely to see you. Priscilla, thank you for greeting me at the door. We had our picky taken already. And to the New South Wales Mental Health Consumer Peer Workforce Committee, all of you have done an inordinate amount of work to get this very important gathering together, and obviously to all of you here in the room. I can see some friends from Northern Sydney Local Health District, and also colleagues from the Mental Health Branch, Tricia and Amy. Nice to see you both here too. I see you've also got Minister Jackson on the agenda tomorrow. Minister Jackson is obviously our new Minister for Mental Health, been in the job for just over 100 days. I'm sure you'll enjoy meeting her. She's a very, very energetic and engaged person, and she feels very, very privileged to be the Minister for Mental Health, as I do to be the Deputy Secretary who has mental health in my portfolio. I think it's firstly to say it's fantastic you're having this forum, because coming together is incredibly important. Only you know the complexity and the stresses of the roles that you fulfil, and I think having a place for you to download with one another and share your own experience is incredibly important, and obviously a great many learnings come for it as well. It's also very exciting to be celebrating the 25 years of this annual meeting and 30 years of established peer worker roles in Australia, quite a milestone. And I do think you really are the trailblazers when it comes to consumer voice. I've been working with some other colleagues in the ministry to strengthen up our consumer voice more generally across health. And all the conversations keep coming back to peer workers, because you guys were out of the blocks well before anybody else. So we've got a lot to learn in terms of how you work with our consumers and their families and each other in terms of what we can do more broadly in improving the voice of consumers in healthcare. It's been said elegantly by Catherine, the importance of your work, and I think and also Catherine made the insightful comment, you are the peer worker, so you know exactly what you do. So I'm not going to stand here and give you a sort of a CV about what your role is, but it is really important that you do know how important we consider these roles, and I think it's the whole concept around elevating human experience, which is another area in my in the division that I'm so lucky to have responsibility for. And people living with mental illness, particularly those that are seriously unwell, are incredibly vulnerable. And your efforts in being alongside them, just being, and listening and helping them navigate the complexity, it's impossible to measure the impact of that. We're obsessed with key performance indicators in health, but I don't think anyone would attempt to try and ascribe any metric to what you add to the care and the well-being of consumers in our system. You draw on your own experiences, and I think again being together today is really important. We need to care for you as well. I don't think we can underestimate the impact on yourselves as you embark on caring for others and doing what you do. I know that there are, I did revisit the Glad They Asked video that the team at Northern Sydney done when I was thinking about today. And it did make me think, there'll be many, many reasons, why all of you do what you do. I'm sure there are some common themes, but you'll all have your own personal reasons. But for me, the common theme that runs through this room and through your colleagues that aren't here is this, quite simply, this generosity of spirit. This generosity of a person to put themselves forward and to bring to somebody the things that they've gained and learned over their life. And I see that in the work when I read about it and the newsletters and when I talk to peer workers. It's just a beautiful common thread. An everyday example of your work when consumers share their stories with other consumers and staff around how the knowledge gained from speaking with peer workers improves their understanding of their own experience and can provide hope by learning firsthand about the recovery experience. The statewide peer-supported transfer of care initiative, otherwise known as Peer Stock, it wouldn't be health without an acronym, is a great example of peer support. This program supports consumers to transition from inpatient care back into the community. And the evaluation has been incredibly powerful out of that program. We've seen us significantly less likely to be readmitted to hospital within 28 days of discharge, and it led to far fewer hospital admissions over the following 12 months, with better contact with community mental health services and overall improved recovery outcomes. So that's got to be a winner. I already mentioned the Glad You Asked video. It showed my bias, done by the team at Northern Sydney when I was there. Not my idea, however, where the peer workers there in Northern Sydney basically did this video to tell the story of why they do what they do and how they do it, and really uncovered aspects of the role which probably weren't always commonly understood. And I know you have a session based on that at this part of the forum, and again, just these great examples of what's going on around the system that can be shared and learnt from over the next day or two that you're together. New South Wales Health has a document called the Future Health Strategy. It's one of those things that, you think it's one of those, glossy plans that departments do, and I guess it is that as well. But what I like about it is that the plan or the strategy was developed basically by staff right across the system. And we had thousands and thousands of staff involved in this, and it just sets the future direction, as the title suggests, about where we're going in health. But what's great about it is one of the key areas of emphasis is around human experience. And as I said at the just earlier on, the role of peer workers and what we can learn from you in terms of elevating human experience, not just for patients and consumers, but for our staff, because the two partners in care are critical. And this is not just a soft, fluffy, nice thing to do to make everyone feel good about being at work or coming into one of our service. There is significant evidence that shows if a staff members feel valued and supported and understood, and equally if patients feel that they're being listened to, that the two things, and cared for appropriately, the two things come together and give a much better outcome in terms of physical well-being, but also how people feel about the system. And it's important that they feel a willingness to return should they need to. So this, again, just to say that we will take on much of what you do already, and hoping to, thread that work through other parts of our service development across the system. It's also really great there's been such a huge increase in peer workers. I mean, I take Catherine's point. We, obviously need more people, that is true, but we need you in more senior roles across the system, and it's something I'll be advocating along with Catherine as we work with colleagues across the local health districts. And you really do hold some very unique, you hold a unique role within the system, and also some in very unique services. The suicide prevention peer workforce also has a critical role to play to achieve meaningful positive change in achieving the priorities of our strategic framework in suicide prevention. And the Minister undoubtedly will flag tomorrow one of the election commitments was around suicide prevention legislation, and we're getting that work underway. Our framework, however, though, is a whole of government, whole of community commitment, detailing the actions necessary to drive down the suicide rate across New South Wales. And again, issues around cost of living, climate change, war. There are many things happening right here in our towns, here in New South Wales, but across the world, that are all impacting on how people feel about hope and the future. We're also focused on improving cultural safety and supporting the expansion of the Aboriginal mental health and wellbeing peer workforce. Cultural safety, Aboriginal people feeling comfortable to come into our services, and that we have trauma-informed care that understands Aboriginal history and context. It's not just a flag out the front of a building or some art in a foyer. It has to be truly informed and respectful, and we have much to learn from our Aboriginal brothers and sisters. The Aboriginal care navigators and peer workers across New South Wales are embedded in our public mental health services to provide this culturally sensitive support, but there's no doubt in my mind we need more. So, in closing, just to state the obvious, you're really important. You're really important to us in the system. You're really important to the consumers and the families that you work alongside. The system needs you. Your teams need you, but most importantly, the people accessing our services need you. I'm really, as I said, thrilled that you're able to come together today. I'm thrilled that you're celebrating this important milestone, and I hope you get a lot out of it, enjoy spending time together, and thank you very much for having me here today. I really appreciate it. Thank you.